Hey, my name is Dr. Sean Price, Clinical Coordinator here at The Fix, and we're now about shoulder deep into our metabolic video series. Remember, here at The Fix, we take a three-pronged approach to healing. Number one, we look at the metabolic status or your nutritional status. Prong number two is your neurological status, and prong number three is your structural status. So in this last series of videos, we've been talking pretty extensively and in depth about the metabolic pathways: thyroid, blood sugar, adrenals, hormones, all these different pathways, the gut, the liver, all these different pathways that are critical to overall health. So once we've got an idea, well, how do we evaluate what your metabolic status is? Well, we do it through a couple of different ways. Number one, we use questionnaires, and these questionnaires help us determine what areas of the body you're having dysregulation in. We take those questionnaires and we use those to determine what labs we need to run. So we run blood work, and when we run a blood panel, it is a very extensive blood panel looking at how is your immune system functioning, how are all your organs functioning, what's your lipid panel looking like, what's your blood sugar, both long-term and acute. We run specialized tests so we can see how your body's responding to blood sugar acutely. We look at your iron levels, your vitamin B12 levels, your folate levels. We look at thyroid function. Most doctors run thyroid tests that consist of maybe 2 or 3 tests. We look at 9 to 13 different tests because we need to figure out where the breakdown's happening. We use saliva testing so we can test the adrenal function and your hormone levels. Because saliva testing, there's a debate in endocrinology: is blood or saliva better? The American Endocrinological Society says that saliva is better because it shows what's actually been metabolized. A lot of doctors still run blood levels. Clinically, I have found that blood levels are not as accurate as saliva levels. Also, saliva levels let us see how the hypothalamic pituitary adrenal axis is functioning. Is that functioning the way it should be? Is it following the right pattern, or is there brain activity with the hypothalamus and the pituitary that's not working properly? We run food sensitivity testing to see, are you eating foods that possibly are causing inflammation in your body and your body's not tolerating it properly? It could be leading to leaky gut syndrome. We actually do in-office clinical testing too to challenge foods and make sure that your body can tolerate them. We can do leaky gut testing to see if there are proteins that have leaked out of the digestive tract that shouldn't be there, which can lead to autoimmunity. We can do hair sampling, we do urine sampling, we do stool sampling, we do all the testing that is necessary on patients to figure out where the breakdown is. Now, we don't do all of these tests on all of our patients. We have a basic few tests that we run to get where we need to go, and then if we're not getting where we need to, we run more tests and we run more tests. But we're gonna uncover what is going on, why is this breakdown happening, and what needs to be done to fix it. All right, so that's the testing, and that's how you customize the information. That's how you find out what's the right information for the patient, what's the right sequence to handle these things. A lot of times, if you do it in the right sequence, you only need to handle 1 or 2 areas and the other ones fix themselves, so you have to determine the priorities. So these labs are very, very critical. Now, the second aspect of this is going to be dietary modification and supplementation. So in the next video, I'm going to talk about the supplementation that we utilize in the dietary modification. Okay, so we'll see you on that video.